So my clinic is almost 3 years old, and I'm having issues with the footfall. There are months where I am doing pretty well, and then there are months which really dips. It just dips. At times, it's difficult to get the rent also. So I'm under this confusion that whether I'm doing good or whether I'm not doing good. And there are months where I'm doing very well, and of course, keeping everything in mind, I try to keep some money away for these kinds of bad months also. But then after 3 months also, 3 years also, we were told that give 1,000 days to a business and it should be like uh, regular follow-ups and regular footfalls. So am I doing something wrong, or I'm not very sure about this? Can you just clarify something
Okay.
on this?
Okay. So just hear me out for the next 5 minutes. I'm going to give you you can say a combination, or you can say a crisscross connection between a few things. Before I go ahead and answer your question, are you marketing yourself?
So marketing as in like I have an Instagram page where I try to post my cases, whichever cases I feel are being done well. I try to post them. I have a YouTube channel also. To be very honest, I am not very I'm not updating it very often. I started with brushing techniques and every education based videos for my patients. I tend to send links to specific patients for specific videos. Like if there is somebody who's having issues with the brushing technique, I try to send the link to that particular video to them. But I'm not emphasizing my patients much on subscribing to it or posting regular videos on it. I
Okay.
have Facebook page. Again, everywhere. Google, I try to get as many comments and as many remarks as possible.
Feedback website.
I do have a website, but then again, the SSL and all that is being done by somebody else, so it lags sometimes.
Okay. Okay. Just hear me out and then try to make a combination or the connection between two, three things. See, were you there when I started the session? I explained about you can say the marketing and the credibility part. Okay. So some of us want to market. Some of us believe paid marketing is the best way. Indeed. No doubt about it. Paid marketing is also known as performance marketing these days. Means it performs. It is a performer anyways. Now, just try to establish the correlation. A new restaurant has opened up in your area. All of us order through Zomato, Swiggy, some sooner or later, or you can say once a week or twice, once in 2 weeks. A new restaurant has opened up in your area. And you have been ordering from a restaurant you are very familiar with, you know it, your kids enjoy it or whatever, your family enjoys it. And suddenly you can say near me, restaurants near me, that list now has that new restaurant. So better wear helmet. So that new restaurant, what do? You go and check out what kind of reviews are there first. You don't check out the pricing. Check out the reviews. How is the food? How is the service? How is the quality? How is the packaging? How is the delivery? All those things. And if you find that, yes, good reviews in all those matters, then you go up and check out the price list. Or sometimes people check the price and then seek reviews. The sequence can be different, but usually people always correlate these two things. Now, when you are checking reviews, you are seeking validation. 1 point. Let's keep it aside. Online restaurants usually who are delivering have more or less the same price. Give or take 5-10% here and there because competition. If they can't reduce their you can say price, what they reduce is their packing container. I know so many restaurants, they say this is the container if somebody orders direct from us. This is the container if somebody orders with Zomato and Swiggy. Because 28% to वही ले जाएंगे Zomato and Swiggy वाले. I can't give it at same price. or I can't escalate it because of the competition. So what they do is they smartly reduce the quantity. So keep this also aside. Now, by going to that review or the feedback section, you are seeking validation. Somebody does a paid ad, gives an ad. For example, these are the services. Please visit our clinic, Dental Smiles, Dental Clinic, whatever name is. So now I'm a patient. I came across your ad. I will first search, who is this Dr. Ankush? Just using your name as an example. Okay. Who is this Dr. Ankush? Let me check him out. I Google Dr. Ankush Bhatia. I find good validation. Okay. He has good YouTube videos. That means he's in credibility and authority on the subject. Let me check out his website. The website has good before and after. One of the prerequisites I always mention is have a virtual or a 3D tour kind of a thing for your clinic and place it as a short video. Don't want a professional one. Let anyone from your family, because the kids and family are very smart. Let someone in your family record it and place it on your website, or through your website provider, you can do it. Virtual tour, before, after cases, and Google reviews or testimonials on your website as well. Whatever Google reviews you are having, that is separate. Transfer them or copy them on your website also. So your three things, virtual tour, your before, after means cases, and your reviews, give a sense of validation to your patient that yes, I can trust my teeth, my health with this doctor. He is worthy of trusting. This is where the role of marketing comes in. Now, whatever you're putting in your website, before, after cases, or whatever you're putting on your YouTube, or whatever you're putting on your Instagram via your cases, that is not a paid stuff. Paid is what you did via Google ads or YouTube ads or Facebook ads or whatever Instagram ads, you did it, performance marketing. It has, you can say, targeted those individuals who you specified would be your target patients. It did that, and those patients, when they came into your net, they tried to seek validation. They got validation on your social media and your website, and they believe that yes, we can trust them. So this is how the chain works in combination. The organic means जो जैसे हम लोग वीडियो डालते हैं, पोस्ट डालते हैं, इन्फोग्राफिक डालते हैं, these are organic content, organic presence. YouTube channel is your organic presence. It is not paid. So that organic content will give you validation, or will give your patient a validation. कि वो paid में जाए, he'll buy from you. The simple reason, even those who say my paid ads are not working, is they are not organically present well enough. पेशेंट को वैलिडेशन नहीं मिला कहीं से. मैं नहीं जानता कौन है, कहीं है ही नहीं आता पता, क्या पता पैसे लेके भाग जाए, क्या पता कैसा काम करता हो. We don't know. Simple one-line rule: nobody is going to buy from you the first time they come across online. They will seek validation. So remember, if you are not marketing yourself, having said that, I'll repeat it. Marketing does not mean only ads, publicity, promotion. Marketing means value addition, educating your target audience, adding something in their lives. I am doing this value addition in your lives. This is my marketing only. Because once this video goes on YouTube after 4 to 6 months, people are going to respect me as an authority. They know it. He knows this subject. He knows this about consent. He knows about practice management. He knows about finance. So I am being established as a credible authority, or giving me credibility and authority as well. So this is how this reaction works. Somebody puts in too much of organic, doesn't go in for paid. He said marketing does not work. You have to complement organic with paid. Somebody puts in only paid but has nil organic. People don't get validation. How is that going to work? So it works in combination. And the bridge for that is Google reviews and website. It is easier said than done. Social media on one side, website, Google reviews in the middle, and paid marketing or paid ads on the other. So if you are not doing either of the three correctly, as you said, paid marketing you are not doing, this is you are not updating, this you are not putting regular content, you know where the fault or where the answer lies for you. Get the answer? Okay. So you have to put in some effort to get results. At least some
Right.
efforts initially. Okay.
Right. Thank you.